Welcome, everyone. I'm Spiro. Thanks for tuning in. And joining me today is Dr. Andrew Kaufman, who is a natural healing consultant, an inventor, public speaker, forensic psychiatrist, and expert witness. He completed his psychiatric training at Duke University Medical Center after graduating from the Medical University of South Carolina and has a BS from MIT in molecular biology. He has conducted and published original research and lectured, supervised, and mentored medical students, residents, and fellows in all psychiatric specialties. He has been qualified as an expert witness in local, state, and federal courts. He has held leadership positions in academic medicine and professional organizations. He ran a startup company to develop a medical device that he patented and invented. Dr. Kaufman, I've had many requests to have you on. Thank you for taking the time to join me today.
Thank you, Spiro. It's great to be with you.
Now, I want to do something a little different today. There's so much conflicting information out there. People are having a hard time knowing what to believe, deciphering what is credible and what is not credible. I don't know that any of us really have all of the answers at this point, but we've all been looking at this very closely, especially given the fact that oftentimes official statements coming from government sources and so-called medical health experts, they keep changing. Now, I personally have a hard time believing anything that the establishment says at face value, given they have a long track record of lying to us. Now, that being said, I would like to include some questions from the viewers, and recently I put out on social media asking people to submit their questions to you, Dr. Kaufman, and there was quite a large response. But before we get into taking the questions from the viewers, I wanted to get your take on this current coronavirus situation in general. At the beginning of this, we were told the projections were going to be very bad with a high mortality rate, which justified the lockdowns, and were all based on computer models, which just so happen to be funded by none other than Bill Gates. But now we have actual data to work with. So what does the data tell us? Should people be concerned?
That's a very good question, and the data is very difficult to interpret because there are a lot of purposeful errors in the data, like, for example, with all of the instructions to put COVID-19 as the cause of death on death certificates, even when in many conditions that it is not related to the cause of death. And this comes, directly from the CDC and other health agencies. So what I've done is, in order to take this error out of the consideration, is just to look at the overall mortality from all causes and compare that to previous years. And actually, the CDC has a page on their website where they've done this. They've compiled the average weekly mortality from the prior 3 years and compared that to the current year-to-date mortality on a weekly basis. And I've been following that. It's updated on a daily basis, and every week a week is added. And essentially what it's shown is that there is roughly the same amount of people dying this year, slightly less according to their statistics, currently 2% less than last 3 years on average. So what this tells me is that there's actually no indication of a new illness causing any excess mortality, despite however it's labeled. And I know we're going to talk about the tests in more detail, but the tests are not measuring a virus and are not accurate in terms of how they correlate with disease. And in fact, there's been no error rate calculated at all for the tests. So my opinion overall is that this pandemic is a completely manufactured public relations marketing operation. And there's actually no virus, no disease, but there are major changes in government policies in virtually all areas of public policy. As we know, of course, limiting our individual freedoms, but also the financial consequences, the food supply chain, the telecommunications infrastructure, and the list goes on and on.
Well, a little bit later on, I definitely would like to get into a bit more of the agenda, which definitely appears, I would agree with you, to be attached to this crisis. Going off of the data that you referenced there, right off of the CDC website, is pretty astounding to see that despite the fact of the media and government sensationalism of this quote-unquote crisis, that the death rate is down, which would indicate that we're not being told the truth. But to outright say that there is no new illness, what will we say then when we see like these clusters of deaths, for example, at nursing homes and elderly people's homes?
Well, normally people are dying all the time, and now what we see is that the hospital beds are essentially closed to people with non-COVID related illness. So people are not going to the hospital, and they're dying at other places instead of the hospital. So whereas, nursing home patients in the past, when they are ill, they would be sent to the hospital, and most likely they would die there. Now they're dying in the nursing home. The same thing with elderly and infirm people living in the community. They would normally, in past years, be going to the hospital when they got worse and would most likely die there when their time comes. And now we're seeing those people dying at home in the community. So it gives the perception that there's a new illness and that people are dying in places that we don't normally see, and it makes it appear as if they're dying in higher numbers. But that's not actually what the CDC's own data collection shows.
Now, I'd like to get more into the testing, as we've had many questions from the viewers, considering the fact that the testing will likely be used to control people's movements and ability to interact in society. Now, I have a question here from @ThomasPWebster. Many of us want to know about the actual test for COVID-19. What does the test actually test for specifically? Will the test show positive for any coronavirus? And how reliable is this testing? And I think that these are great questions here, because it's my understanding that the test was actually created long before this new or novel coronavirus came onto the world stage.
Well, yeah. So the test is kind of a big quagmire, and it's definitely not reliable. And in fact, we don't really know exactly what it's testing for. So the main test that is being used is this PCR test, or technically RT-PCR, which is used to amplify small strands or small amounts of strands of RNA. That means that it's not testing for a virus. And in fact, there's been no virus that has been isolated from any samples of any patients with a respiratory illness. They have made claims as such, but I can certainly explain in detail that they didn't actually find a virus. But the way I understand they developed this PCR test is that they took samples of lung fluid from some sick individuals initially in China, and they basically reconstructed a sequence of RNA through a process where they combine short strands of RNA by a method called alignment, and sort of reconstruct what they call a viral genome. Now, normally, if you wanted to obtain the genome of a virus, right, and this has been done, for example, for bacteriophages, which are perhaps misrepresented but have been called a virus that infects bacteria, what they would do is isolate and purify the bacteriophage particles. And then once they're in a pure state with no contamination, they could then do a chemical characterization of the structure of those particles. And that would include extracting the genetic material and performing a full sequence of the genetic material to obtain an entire genome. And that's been done for bacteriophages. But that's not what has been done for this SARS-CoV-2 virus that they allege to have identified in these studies. Instead, what they've done is taken an impure sample of lung fluid and not purified it at all, but just used PCR probes looking for specific sequences that they've already identified as being related to viruses, and then using that to reconstruct bits of DNA and combining them into a model that they say represents the genome or the entire set of genetic material of this virus. But since they didn't obtain it from a purified viral particle, there's really no way to know exactly what the source of that genetic material is. But most of the genetic material that would be present in the lung fluid of an ill individual would be our own genetic material, and also that of other microorganisms that normally live in our body or were involved in an infectious process in those people. So these could easily represent strands of RNA that are human and that are bacterial. But the thing is, we just really don't know, because it's never been compared to something that was obtained directly from a purified virus. So it's measuring these RNA strands of unknown significance. And the way that they allege that this is a coronavirus family, and in fact they say it's related to SARS-CoV-1, which is the virus that they used the same procedures, by the way, to say was the cause of the SARS outbreak in 2003. So they basically looked at the sequence that they reconstructed by this artificial method and compared it to the sequence that they reconstructed by the same artificial method from the SARS-CoV-1 virus, and say that they're almost 80% identical. Therefore, they are part of the same coronavirus family or they're related. Now, just to contrast that, when you compare the entire genetic sequence of humans versus chimpanzees, they're 96% identical. So that's much higher. And yet you wouldn't say that we are chimpanzees or the chimpanzees are humans. So they're relating these sequences together that are reconstructed arbitrarily and saying because of this 80% identity that it's a coronavirus and related to SARS-CoV-1. So it's a huge stretch by any stretch of the imagination. I mean, there's no way really to confirm that this is a real entity or really related to something else that also we don't know if it's a real entity at all. So when you subject yourself to this test, you're basically, and this is without considering any of the pitfalls of the PCR method itself, right? Which there are some. So even without considering that, you just don't know exactly what you're measuring. And so in some field tests where they've tried to use mathematical models to calculate an error rate, they come up with a number like 80% false positive. So that means, 4 out of 5 people with a positive test don't even have what they say that they have.
Thus inflating the numbers on another scale. Now, when you say they removed this genetic material from the lungs, can you tell us about who was involved in this process, when, where it took place, and is this they only did it like once, and this is the standard now? I mean, shouldn't there be I don't want to say a fact checking, but I mean, shouldn't there be processes in place to, re-verify this? I mean, if it is such a serious global health pandemic crisis, wouldn't we want to have like a peer-reviewed, type of a test?
Well, it goes even deeper than that, Spiro, because they didn't even do a control group. So, one of the basic rules of doing a scientific experiment is that you have a negative control group so you can isolate the effects of a single variable, right? And in this case, the variable would be the genetic material from a virus from a sick person, right? So what they could have done is taken the lung fluid from people who did not have the illness and make sure that they don't find the same genetic sequence in those people. Right, and this is a very standard thing. Like every time I've done any kind of experiment that was going to be published, there was always had to be a control group. And they didn't do this basic step. There's no control group. But if they would have done that, most likely they would have found the same genetic sequence in that control group of healthy people's lung fluid. So that would have been really useful. Now, of course, you need to also do this with more patients, right? So the original study comes from China, where they examined the lung fluid from patients from the food market in Wuhan. Okay, but they only had 9 patients, and they could only extract this material from 7 of the 9. And that's the total set. So it wasn't like they had 250 cases, for example, which would give it a lot more validity. Then the same exact procedure has been done several times since then in different places. But to my recollection, it's only been done with a single patient. That's been done in Korea. There's a group in Canada who haven't published yet. And there's one other publication, I can't recall where it's from off the top of my head. But essentially, they've done the same exact procedure in all those different studies and have gotten slightly different genetic sequences, by the way, but they say that that's explained by the virus is mutating.
Well, it seems like, for being such a serious situation, that as we're told, that there would be a lot more, fail safes put into place, or double checking of work and as you stated, basic scientific methods and approaches that should be applied here. One of them you talk about is Koch's postulates, which you have gone through several different reports and studies that were published claiming to have gone through this standardized method to verify some of this information. And could you tell us a little bit about what you found?
Yeah, absolutely. So there was a paper in 2003 that claimed to satisfy Koch's postulates for the SARS-CoV-1 virus, right, which they relate to this current alleged virus. It was really fascinating how this played out. But let me just remind everyone that Koch's postulates are a set of rules put forth by the proponents of germ theory, because what we're really talking about is germ theory, right, which says that some agent of a microorganism outside of your body comes in and invades and causes disease. So these are sign of some common sense rules that you should basically have a disease that's identifiable, be able to extract a microorganism that's the cause from the people sick with that disease, but not from people who are healthy. And then you can isolate that infectious agent out of the sick people, and you can give it to a healthy person or animal host and cause the same disease, and then also re-isolate it from them. And this was attempted to be applied to viruses when they were first thought to be discovered under the electron microscope, but no one was successful at, as far as I know, even the first step of isolating the virus from people with the disease. So they tried to modify this a couple of times, and the one modification was based on an article from Thomas Rivers. And he basically reasoned that it was too difficult to prove Koch's postulates for viruses, so we should ease up on some of the criteria. And so in that 2003 article that I mentioned, although in the title of it says Koch's postulates were satisfied, in the first or second paragraph it said that they actually used Rivers' criteria, which was an adaptation of Koch's postulates. So right there you see fraud in how this information is represented. They also misinterpreted Rivers' paper and synthesized 6 criteria, but really they weren't 6 criteria talked about in the Rivers paper. And then they mentioned that the first 3 of the 6 were satisfied by these other publications. And so I looked at those, and they followed the same exact procedure that I described for SARS-CoV-2, which didn't isolate any virus. So basically the first criterion or the second criterion of Rivers was not satisfied. And then, of course, they didn't actually satisfy any of the other criteria. One of them is quite simple, actually. It's filterability. And that's really important to purify a virus particle because it's much smaller than all of the other cells, and you can purify it substantially just by putting it through a filter. And this is never done in the studies that claim to isolate a novel virus.
So basically, at this point, they have not met the standardized procedure to isolate this particular SARS-CoV-2, COVID-19, which is referred to as virus. So therefore, what you're saying is we don't even know for sure if it exists because they haven't been able to prove it. And then we see that the testing itself is flawed in many ways, not only giving false positives, but the method in which they are testing does not really make sense scientifically. And correct me anytime that if I'm wrong. I'm not a scientist or a doctor. And then what you're saying is through Koch's postulates, which is meant to prove beyond a shadow of a doubt and replicate or reproduce a virus, has never been accomplished before for any virus ever. So would that call into question viruses themselves, like in their existence? And if that's the case, then how do you explain when people get sick? You know, like when they catch the flu or, they just feel like crap. I mean, we all thought it was viruses, right? What can you tell us?
Yeah, Spiro. So you're hitting all the important points, and yeah. So let me just correct that. Satisfying Koch's postulates actually doesn't even prove beyond a shadow of a doubt. It just gives you a fair degree of certainty, and it's never been satisfied for any of these viruses.